because I have to look up stuff on charts and tables and stuff like that to do. If you don't have a book, yeah, you make sure you get it, because we're going to have those little tests and so forth, and you're going to need the book in order to answer some of the questions and stuff because some things are in the textbook. Okay, and the guidelines have changed. The old guidelines were ACSM guidelines. Before you started an exercise program, you need to go check with your doctor. Okay? And so, and it's based on risk factors. Okay? And so, at my age, I'm above, I think it's 45 for men, 55 for women. I'm above the 45, so that counts as a risk factor. Okay? And my cholesterol is a little higher than normal, but it's just been that way forever. And so that's two risk factors. And they say, okay, before you start an exercise program, you need to go to your doctor. Do I need to go to a doctor before I start an exercise program? No. And that kept a lot of people from starting an exercise program, because what do they say? Go see your doctor before you start. Get cleared or whatever. And so it was all based upon risk factors. Okay. And so then the smart people, the American College of Sports Medicine, and the people that make the guidelines and so forth, they said, well, this isn't working. We don't have enough doctors to handle this, and people aren't going anyway, and plus they don't really need to go see their doctor before they start an exercise program. If you go out and do a walking program, does grandma need to go see a doctor? And so no matter what fitness level, probably not, right? So it says it's better to go ahead and start your program and go from there. Okay. Now we're not talking about running marathons. We're talking about basic exercise program. Okay. And so that's why they've changed the guidelines there. And so instead of risk factors, now we look at signs or symptoms of cardiovascular disease. So if you have any signs or symptoms of cardiovascular disease or metabolic disease or whatever, then we sort of start worrying about you a little bit, right? Now, exercise can kill people, right? People have died, okay? And usually it's hard-headed people like me that don't pay attention to what they're doing. But if you've got chest pain and you're in a 5K race, you don't need to finish the race. You need to get help. And I've been in a lot of races, and I've seen at least 4 people die during our runs or races. At least 4. Okay, I've seen 2 at Seaside. I saw one in a church out here in Montgomery, and then I saw one in Birmingham. There, some of them are your age. Okay, and so you're at a greater risk. But then, if you look at the big picture, if you're fit, you're at much less risk than somebody that's not fit of having a heart attack. Okay? And so in terms of the risk-benefit ratio, you're better off to do what? Run, exercise, right? Because if you're not fit, well, those people up north that shovel snow, that kind of stuff, and in the winter they hadn't done any exercise and they go out and work hard or whatever, then they get into problems. And so the same thing around here, in terms of all of a sudden you start something new or different and it's harder than what you normally do, it can stress the body, and you have to be careful there. So we have signs and symptoms of cardiovascular and metabolic disease, and we have risk factors that we look at. And a lot of times when physicians do medical exams, well, they're not exercise people. I've been to some doctors that had blood in the urine, that kind of stuff, and they diagnosed it one thing, and it was related to exercise. It wasn't related to bad kidneys or whatever. It was rhabdo, and so the physician wasn't even familiar because he wasn't familiar with people that do a lot of exercise there. Okay. So, do you need to go to the doctor? Probably not. You athletes, do they screen y'all? Y'all have a physical before you play? Okay, and so you have a physical. And there's always controversy on that physical. Well, maybe we should do an EKG also because of heart issues, or maybe we should do this, or maybe we should do that. But it's pretty expensive to run all these physicals and stuff, and it can cost some money there. So now we have new screening tools. We have health appraisals, and we're trying to figure out who's it's safe to exercise and who it's not safe to exercise, and so forth. One thing that's important to know is their current physical activity levels. You know, what are they doing right now? Are they active? Are they not active? Are they just starting a program? And so it's different. If you've been on a program and exercising, it's different than somebody that's never started a program before. Okay? And so, you know, you wake up one day, you're 50 years old, and you say, I need to start an exercise program. You've never done anything before. We've got people called weekend warriors. They go out and they play club soccer on Saturday. They hadn't done anything all week, and they get really sore and tired, and then they don't do anything. They go back out again the next Saturday, and so forth. And so sometimes those people get into trouble because they're just not fit, and it's sort of sporadic in terms of their exercise there. So let's look at the book. And chapter 3, we're really getting to the meat of the stuff now. On page 38. Yeah. You see a big table, right? And so I'll share it with you. Okay, you see a big table. Everybody got that? You know, you can share, but you got a social distance too, so I don't know how you work that out, but we'll do the best we can. I can pull it up. On PowerPoint, but it's not that great. So here's the table, and you got to be able to follow it. It looks really complicated, but it's not that complicated. Okay, let's say Macbeth comes in, and I'm going to do an exercise program for her. Okay, and so first of all, I got participates in regular physical activity. So I say, hey, you participated in physical activity. And so what is participation in physical activity? Okay, look down at the bottom, below the chart. Performing planned, structured physical activity at least 30 minutes at moderate intensity at least 3 days a week for at least 3 months. Okay, so that's the guideline in terms of physical activity, right? 3 months of what? How many days per week?
3 days a week.
3 days? What? 30 minutes? Okay. So if she's been doing that, we would say that she participates in physical activity. If she's not meeting those guidelines, we would say no. Okay? Makes sense? Okay. So when I give you a problem, you'll say, hey. I'll say, okay, Macbeth is been exercising for a year. She does 5 days a week, 30 minutes a day, and so forth, and walks and that kind of stuff. And so, yeah, okay, participates in physical activity. Okay, then we've got cardiovascular, metabolic, or renal disease. So we're going to check for that. So what is, and these are signs or symptoms or they have the disease. And so look on the, can't see that there, but here, if you look at signs or symptoms suggestive of cardiovascular, metabolic, and renal disease, here are some of the signs or symptoms. Pain, discomfort, or other anginal equivalent in the chest, neck, jaw, arms, or other areas that may result from myocardial ischemia. So in exercise physiology, you learned what angina is, right? What is angina?
Chest pain.
Some countries they call it angina, huh?
Chest pain.
Chest pain, right? So it's chest pain, okay? And so why do you have chest pain?
You know, heart issues, also the anxiety.
Okay, because of ischemia. So what is ischemia?
That's lack of blood flow.
Lack of blood flow. So whenever we get lack of blood flow, we get ischemia. Ischemia can cause angina, and that can cause a heart attack, right? So if we cut off the blood flow to any part of your body, what is the body going to do?
Gonna let you know.
It's going to hurt. Now you put a rubber band around your finger and see how long you can stand it. You ever tried that? So after a while it starts to hurt because you don't get any blood flow, and we talked about that in exercise physiology. How do they castrate calves?
Tie rubber band.
Yeah, they take a rubber band and they put it around their testicles, and then their testicles fall off. Okay, and so now it's not a bull anymore, and it's a steer. And so the difference between a steer and a bull is bull has testicles, steer no testicles. Okay, and so because bulls get mean and nasty, steers are more friendly. So that's the difference. And so yeah, and so they fall off because of lack of blood flow, right? Okay, and I've had some little calves and stuff like that back a long time ago. I sort of felt sorry for them, but it's their problem. But yeah, it's whenever we occlude and in the heart, in the arteries and so forth, we cut off the blood flow through a blockage or atherosclerosis or anything else, then we get into trouble, right? A lot of the times, like the carotid artery, we don't get blood flow in the carotid artery, and they have to go in and rotor-rooter the carotid artery to get good blood flow there. And so you may not get, you may have pain, but you also may be dizzy and so forth. And so, but there's differences between chest pain and chest pain related to heart disease, cardiovascular disease. So probably all of you had a little pain in the chest someplace or whatever. A lot of it's from indigestion or something like that. And so, but then if you get pain in the left arm and it radiates up your left arm and goes up into your neck and so forth, into your jaw, that is related to a heart issue. So why do we get all that pain in the left arm all the way up to our jaw and so forth? Because the nerve there, right? The nerve, if it doesn't get enough oxygen and doesn't get a good blood supply, it's a symptom of a heart attack. So you're riding in the car and somebody starts to have chest pain, they start to ache, their left arm becomes numb and so forth. That's a symptom of a heart attack, cardiovascular disease. Do we exercise people with angina?
Yes.
We do. And that tells us what? It tells us when they're not getting enough blood flow. And so with cardiac patients or whatever, we'll say you can exercise up to the point where you start to feel a little pain in the chest. Because when they feel that pain in the chest, that means what?
They're not getting as much.
They need to slow down a little bit, right? And so we do use that, but when we use it, we've got medical people there, we've got physicians there, we are, even in a cardiac rehab program, we can say you can exercise to a heart rate of a certain number, and we know that number relates to pain in the chest. It relates to angina. Okay, So yeah, we do exercise people up to that point, but we know what we're doing, okay? But if you're out running a race, a 5K or 10K, and then you get that burning in the heart or chest or whatever, you tend to get into trouble there. Years ago, when I was young like you, I did a study on there's something called the Bachelor effect. And there's a guy named Bachelor, and he said anybody that's ever run a marathon has never had a heart attack. Now, running wasn't popular before 1970. If you were running down the roads or whatever, they would thought something was going bad wrong. It's like, who's chasing him? Did he rob a bank or something? It's like running wasn't popular. Okay, and so running became popular in the 70s, and the people that ran were hardcore people. Okay, they loved to run. They were athletes and so forth. And they said, well, anybody that's ever run a marathon has never had a heart attack. Well, we found that wasn't true, but it took them 10 years to prove him wrong. Okay, 10 years. Okay, and so then they started getting all these people that were in their 40s and so forth, because then we had a guy named Jim Fix. He wrote the book on running. Running got popular. People were becoming inactive on their jobs, and people started to do a lot of running. So I know all the history of running and so forth. But then what happened is I look at the autopsy results of all the guys that died while running. Okay, and it wasn't that many. You only had like 50 or so. And so I got the autopsy results and then looked at them. And so this is like the forensic stuff on TV. You look and say, why did these guys die? Let me look at their records and so forth. Every single one of those people that died had other risk factors. Okay, they either had high cholesterol, or high blood pressure, or some other risk factor that was related to the heart attack. So, did running cause a heart attack? No. They had a heart attack while they were running. Running didn't cause that. Okay, more people die in their sleep than they do running. Does sleep cause a heart attack? Should you not sleep? Huh? And people will see you out running, and they'll throw beer cans at you and holler and scream at you and stuff like that. And so, but people have heart attacks. Over half of you in this room will die of a heart attack unless something changes. Over half of us. Okay, and so it's a number one killer, right? Okay, and so eventually our arteries tend to block up, and occlude, and tend to don't get a good blood supply. They did a study on guys that died in the Vietnam War, and so it was easy for them to study them because they had lots of bodies. Okay, and so they get the bodies, and then they do an autopsy on the bodies, and they look at the hearts. And these are people your age, and they already found that they had streaks of atherosclerosis and stuff in the arteries of people your age. It was starting to begin. Now, with all the little kids that aren't exercise stuff, they're starting to see it in little kids, young kids. Yeah, and so what happens then, it starts to occlude, and it gets worse and worse and worse and worse, and then one day it just stops up the blood flow there. And the body's pretty remarkable. They don't say you have heart disease until your arteries over 80 to 90% blocked. So you may be walking around and running races with 80% blockage. You not even know it, and you may be running like a 20-minute 5K or whatever. Okay, but you still may have some blockage there. Okay, and so that's why they go in and they take the catheter and they run it in and release a little bit of dye, and then they can look at the arteries and see what's blocked and what didn't block. If you get a chance to shadow some of these physicians or something, the cardiologists go in and let them watch the procedure or whatever. It's pretty interesting. They have to be pretty good to take that little floppy little wire and take it and run it up into your heart and release that dye there. Because how many coronary arteries do you have? You have 3, right? You have 1 on the right side and 2 on the left side, right? And from those 3 coronary arteries, the heart gets all its blood supply from those 3 arteries, okay? And so the heart pumps blood through it, but the heart's got to get blood supply. So off of the aorta, where the heart pumps out, those 3 arteries branch from that. And how big are they? About the size of a spaghetti noodle. And so they're not really, really huge. And so a little blockage will stop up those spaghetti noodles, right? And so that's why we got to keep our arteries clean and healthy and so forth. And exercise helps to do that. So then if the artery gets blocked, then they have to do bypass surgery. Okay, bypass surgery is they'll take a vein out of your leg, and then they'll take it, and they'll put like a little patch job on your heart. And now the blood can get from here to here because they got a little patch in there to get the blood through there. And then if there's any problem, we can do an EKG, and we put the little electrodes all right here, and we can measure, okay, what part of the heart is blocked up, because you don't have good electrical conduction in that part of the heart there. So we're looking at what? Signs and symptoms of cardiovascular disease, right? And so do they have any pain in the chest? Do they have a hard time breathing and so forth? It could be post-exercise. And then the study with, not the study, but the story with Elvis Presley. How did he die?
On the toilet.
Yeah, sitting on the toilet, right? And so whenever you strain, what does that do to your blood pressure?
Increases it.
Put your hands together. Everybody put your hands together, and I want you to strain hard as you can. When I say go, ready? 1, 2, 3. Stop. So what did we just do? What's it called?
Valsalva maneuver.
Valsalva maneuver, right? Valsalva maneuver. Whenever we strain, we don't breathe. We don't breathe because we're trying to increase what? Force. We're trying to increase what? Pressure, right? And what does that do to your blood pressure? Goes up, right? So your blood pressure goes up. How high will your blood pressure go up?
Can it go up like 3 times?
It'll go up pretty good. It's we had a guy in Auburn that took some Army Rangers, and they did a study on you can't use a blood pressure cuff to measure exercise blood pressure. So they took a pressure transducer, and they put it in his artery, and then every time the blood pumped, you could measure the pressure. Okay. So they took these guys, and they had them lift really, really, really heavy weights. Okay. And their blood pressures were like 300 or 400 millimeters of mercury. Okay. And so there have been people that have strained so hard that their capillaries in their eyes burst. Okay, and they got blood in their eyeballs and stuff because the pressure got so high there. So anytime we strain really hard, that increases blood pressure. And that's one reason that sometimes they don't recommend isometric exercise. So isometric is what? It doesn't move, right? So we push against the object or whatever, and we create force, but there's no movement there. So that's isometric. So we told this story in exercise physiology, but Elvis Presley was a famous singer, and he was taking drugs, and certain drugs do certain kinds of things. We have uppers and downers. I'm not a drug expert, but downers tend to slow everything down. Now, your intestines are muscles, and they send waste products through the body, but they send it so slow, right? Now, what if you slow all that down? It goes even slower, and then you're stuck, and the waste product is not going through the body. So you go into the toilet, and you're straining, trying to relieve yourself, and nothing's working, and then your blood pressure goes way up. And then the forensic stuff is proving this, that it caused Elvis to have a heart attack. Okay. So You have a heart attack on the toilet. You have a heart attack while you eat lunch. You have a heart attack while you're running. You have a heart attack any place, okay? But you tend to be at more risk when your pressures tend to go up because that puts extra stress on what? Heart, right? And so it puts stress on the heart. And then if you've got a weak heart, if you got any issues with the heart, then that can cause a blood clot or heart attack. It's pretty simple, isn't it? Pretty simple. And so that's why we have defibrillators. Okay. And so that's why in the gym or whatever, if you work in exercise, you have to have CPR training, and you also need to know how to work the defibrillator, right? Because the defibrillator can save lives. Like the guy that died in the hot tub. You were working there then, were you?
No, I wasn't.
Yeah. And so what happens, and I'll explain this. Some of the stuff's repeated what I told you last semester, but what happens is when we exercise, the blood leaves our core and goes to our muscles, right? Okay. So right now, 80% of your blood is where? Core, right? Your legs don't need much blood right now because they're not working. Your arms don't need much blood because they're not doing anything. So then we exercise, the arteries in your arms and legs or whatever muscles you use for exercise open up. Blood leaves the core. Sometimes that's why you get a little sick at the stomach because the blood's going out of your stomach into your core, into your, not the core, but going into the muscles that you're exercising with there. So when that happens, the blood goes from what? One place to another place. When you exercise, blood leaves the heart, core, goes to the muscles. The fellow that passed away had a heart issue, okay? I don't know him or anything, but he had a heart issue. Then, get in the hot tub. The blood does not go back to the core. Where does the blood go? It's trying to cool you off, right? And it goes away from the heart. So now, all of a sudden, if the heart is not getting enough blood in it, it can pump, but it's not pumping blood out. What is it going to do? Go pump faster, right? And so it starts pumping faster. Well, this isn't working, I need to pump faster. This isn't working, I need to pump faster. So then it starts pumping so fast that it causes what we call an arrhythmia. An arrhythmia is what? Irregular heartbeat. And then instead of the heart going boom, 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 it goes, does all kind of crazy stuff. And then that's when you need to put the defibrillator, boom, and then do what? Get it back on rhythm, right? Get it back into a normal rhythm. Some people have internal defibrillators. And every time the heart gets out of rhythm, it shocks them. I'll tell you a funny story. Dr. Maherd is our physician. He's an emergency room physician. And so he was in the emergency room, and this woman came in, and she had an automatic defibrillator. And it was going off about every 30 seconds. So she was getting shocked about every 30 seconds, and her heart would boom. And so it's like touching an electric fence every 30 seconds. And he's an emergency room physician. He's not a cardiologist, and so he can't go cut her open and take that thing out. And so he's got to get her to the cardiologist and get that thing out of there, and so and to get it where it's working right. And so pacemakers have done that. My mother had a pacemaker, and they put it in wrong, and then it goes off when your heart rate gets either too low or whatever. So she'd be laying in bed, and all of a sudden her heart would start bouncing in her chest, and she said, "This is not right." And so they had to go back in, and they had to take that little pacemaker out and put another pacemaker in. They said it's really not very normal, doesn't happen very much, but if it happens to you, and you're laying in bed and all of a sudden your pacemaker is going off, that's not a whole lot of fun there. So the heart's an interesting organ, and so it's a pretty simple organ because all it is what? A pump. And how long is it good for?
I'd say like 180 to 100 years.
Yeah, over 100 years, right? Over 100 years. Okay, it should work for 100 years plus. If, what's the if? If you take care of it, right? And so if you take care of it, okay, so that's why you need to do what?
Exercise.
Yeah, it's like any muscle. If you don't use it, you lose it. So the heart's a muscle. You got to exercise it. You exercise it, gets stronger. It adapts to exercise, right? The left ventricle, it gets bigger. It pumps more blood with each beat, so it doesn't have to beat as often. With weight training, the left ventricle gets thicker. Because with weight training, we're always working against stress or force and so forth. And so our blood pressures are much higher when we weight lift than when we do jogging or running or something like that. So then puts a lot of stress on the heart, and that left muscle gets thicker. The left ventricle gets thicker. It'll get thicker from high blood pressure too, because now it's having to work against pressure, so the heart gets thicker. But that's not good, because with exercise, after you work or train it, it gets bigger, but then the heart rests and recover, right? But if the heart didn't rest and recover, you have high blood pressure. It's having to work all day, all night, every day. It just wears it out. It can cause a heart attack. And so, yeah. And if you went to the doctor and they said, well, you got left ventricular hypertrophy and you got a thick muscle wall or whatever, that's normally what they see with people with high blood pressure. That is not the athlete. Okay? And so the EKG will show a high R wave. It'll maybe show a high R wave with somebody with high blood pressure. Okay? And so one's a healthy and one's a not healthy symptom there. Okay? So the doctor needs to know that you exercise when you go see the doctor, right? Because exercise people, they have some symptoms sometimes that aren't normal, and they'll think that's something that's not good. So we're looking at signs or symptoms suggestive of cardiovascular, metabolic, or renal disease there. Dyspnea, what is that?
So like the thing in the older days where they would adopt dysentery,
Nah,
no.
that's good. I like that guess. So.
Isn't that difficulty breathing?
Difficulty breathing. So, if COPD or whatever, you may have a difficulty doing what? Breathing, right? And so that may be a sign or symptom of disease. Okay. Cardiac pulmonary disease. Syncope is what?
That's when you pass out because your blood pressure is too high,
Too high?
too low.
Too low?
I don't remember. I know it's something about your blood pressure.
Could be too high, too low. Okay. And so, you ever get dizzy? All of you been dizzy once in your life? Okay. Yeah, I used to get dizzy a lot. And so, normally, when you're laying in bed and you get out of bed real quick, you may get a little dizzy sometimes, right? And so, especially if you're an athlete and you've been sweating and training like soccer and volleyball and so forth, all of a sudden you're laying in bed, and then you get out of bed, and all the gravity pulls your blood where? To your toes, right? And not enough blood in your brain, and so then your heart has to do what? Okay, got to catch up, and so it's got to pump what? Faster, and so yeah, you're dizzy. You get up, all of a sudden, oh, okay, and then what happens? Heart rate increases, and you get blood to the brain, and then you're ready to go. But we have people that happens to, then they get an appointment with what? Hey, I get dizzy all the time. Well, you get dizzy because you jumped up. And one of the things we do in the physiology labs is we'll measure blood pressure seated and after they stand, and look at the changes in the blood pressures from seated to standing there. So that's normal. some is normal, but if you start to pass out, or if you get vertigo or whatever, that's awful. And so that can cause some problems there. Orthopnea, proximal nocturnal dyspnea, okay? And so shortness of breath, you may be laying in the bed and then you can't sleep and then you start breathing really fast or whatever. That can be a problem. Ankle edema. What's ankle edema? You ever had that?
Swelling.
Swelling in your legs and feet and so forth. And so,
Or long flights.
yeah, long flights, when you fly to Europe or whatever, you're sitting in an airplane seat, all the blood goes to your lower legs or whatever, and it doesn't get back to your heart or whatever. Heathrow is like the heart attack capital of the world because all these people fly into Heathrow and then they have heart attacks because all the blood pools in their ankles and it clots, and then they get out and they start running through the airport and the clot goes up to their heart or brain and then they have problems there. So you're a English guy. You seen any of that? Yeah, so wiggle your toes, don't cross your legs, get up and walk around the airplane, move around a little bit. Yeah, and so, but there have been studies on that, and it was really a lot worse before they had the luggage that you roll around. And so used to they had to carry these heavy bags to the airport, and so then their blood pressures got high. Now everybody rolls in a little suitcase too, and so that helps. But there are a number of heart attacks related to sitting a lot, and can cause some problems. Got bugs, fogged up glasses. Okay, so back to our chart. So, signs or symptoms suggesting cardiovascular and metabolic. What's metabolic disease?
Diabetes.
Diabetes. Okay, and so that's simple. You have type 2 diabetes, you do, you have what?
Metabolic
disease. Okay, so if you have metabolic disease, you know that is a risk factor there. Okay, so here we've got a person who doesn't exercise, they have no signs or symptoms of cardiovascular, metabolic, or renal disease. So do they need medical clearance?
No.
No medical clearance is necessary. And so then what can they do?
Light to moderate intensity exercise.
Okay, light to moderate intensity exercise. So what is that?
Most like up to 6 minutes of work, so walking, maybe light jogging.
Okay. So light to moderate would be, up to 3 to 6 minutes, right? I'll show you something here. Talked about this, I think, last time. This is the compendium of physical activity. And so this is where they went in and measured all these things to look at how intense it was there. It's on your blackboard. Different language. Okay. And so this is a huge study. A couple of my friends got a University of Tennessee, named Dave Bassett. I've done work with him before. He's one of the guys here, and then the lady from Arizona is one of the people that worked on this. And so you'll see their names here on this. So, activity categories. categories. What do you want to look at? Like dancing? Okay. This is general, it's not, it is not 100% accurate, but let's say ballet, modern, jazz, or general, rehearsal, or class. That is classified as 5 minutes. So what does that mean?
Moderate intensity,
Yeah, moderate intensity exercise. So if we wanted somebody to be able to do moderate intensity exercise, maybe that's something they would like to do, right? Okay. And so tap dance, 1.8, aerobic dance, 7.3. So what would we classify aerobic dance as? Vigorous, right? You know who started step aerobics in the U.S.? Jane Fonda. Y'all ever heard of her? Who'd she marry? Ted Turner. Think she's got some cash? You know who Ted Turner is? Y'all don't know who Ted Turner is? He owns all these baseball teams, and he owns TV stations, and so forth, and so multi-millionaire, and so he's got a lot of money there. Okay, so there's some different categories. Aerobic dance wearing weights. Ooh, that's 10 minutes, right? So that may be too hard for what?
beginner.
Yeah, we wouldn't put this person on that particular 10 minutes, right? And so that's a VO2 of what, 35? That's higher than some maxes of some people, and so that would probably be hard to do. So probably wouldn't want that. Probably wouldn't want to do that. So they've done studies on all this, and they've come up with some basic guidelines. So if I ever want to look in terms about how hard something is, we can go in and look at this. You know, fishing and hunting, running, sexual activity, sports, walking. Let's do walking. Okay, walking. So here we are walking, backpacking, 7.0 mats. Carrying a 15-pound child, 2.3 minutes. Carrying loads upstairs, 8.3 minutes. Loading, unloading a car, impelled walking, carrying loads. Carrying a 74-pound load upstairs. Would you recommend that?
Not for.
You know, that's 74 pounds carrying them upstairs. That's pretty heavy, right? And so that's like a firefighter. You can have a capacity of what? 12 beds, right? And so we can look and see, investigate scientifically how hard it is to do certain kinds of activities based upon MET levels. And the good thing is the research has been done for you, so you can go in and look it up, and then we can see in terms of what particular category it is. So we're looking at moderate intensity, light to moderate. Then we look down here in terms of light intensity exercise, 30 to 40% of heart rate reserve or VO2 reserve, 2 to 3 METs, RTE and 9 to 11. Intensity causes light increases in heart rate and breathing. Okay. So we got that. Let's take a person Sally. Y'all know Sally? Sally was a hurricane, right? Yeah. Came to my house. So Sally, let's say Sally has a rest